Okay, so my name is Mikayla, and today I'm going to tell you about contraception and the different types that are available and how they can work to prevent pregnancy and STIs. So first we're just going to go through a list of the different types of contraception that are available. So there's the pill, there's contraceptive injections, there's Plan B one-step, there's the intrauterine device, or as most people know it, the IUD. There's the birth control implant, the common brand is Nexplanon. There's the vaginal ring, or the brand is the NuvaRing. There's the birth control patch, there are diaphragms, and then of course condoms, which most people do know about. So first we're going to go over what the pill is. The picture on the screen is what it looks like, what most types of the pill look like. It's a medication taken by mouth daily to prevent pregnancy. The hormones in the pill are estrogen and progesterone, and the goal of those is to prevent the egg from meeting the sperm. The pill is safe, effective, convenient, easy to get with a prescription. Forgetting to take it decreases its effectiveness, so it's super important you remember to take it. And then some side effects of the pill. So some women can experience spotting, bleeding between periods, breast soreness, nausea, headaches. Those are just the typical symptoms of the pill sometimes. And then it's important to know that the pill does not protect against STIs. Its most important goal is to protect against pregnancy. So contraceptive injections. These are shots that are injected into the body and they contain hormones. So one shot lasts in the body 8 to 12 weeks. And they have the same effect as the pill, so they use hormones. And then the injections are about 99% effective. And then the picture is what the injections usually look like. So the contraceptive injections are a form of contraception, obviously, but they do not protect against STIs. And then people who get pregnant while using the contraceptive injections get pregnant because they forget to renew their contraceptive shot in time. They forget to get a new prescription. So there's also Plan B one-step, which helps to prevent pregnancy after unprotected sex. So it's like what it sounds like. It is what it sounds like. It's Plan B. So it helps prevent nearly 7 out of 8 pregnancies. It's fairly effective. The side effects, the most common side effects are a period that is heavier or lighter, spotting, nausea, lower abdominal pain, cramping, tiredness, headaches, dizziness, and then breast tenderness. So it's FDA approved, and then you can get it over the counter at Walmart, Target, Walgreens, wherever you can think. You can get the pill, and then it doesn't work if you're already pregnant. It's not an abortion pill. And then it's important to know that Plan B does not protect against STIs, HIV, AIDS, stuff like that. It's just to prevent pregnancy. And then this is just a picture of it. It's just a little pill that you take, so it's super easy. An intrauterine device is an IUD. So it's the longest lasting and most effective form of birth control, besides abstinence, of course. So it's a T-shaped device that's inserted into the uterus by a physician. You can't do it yourself. You have to go to the doctor, Planned Parenthood, someplace like that. And then it has to be changed at least every 5 years. This is a picture of it. It's not true to size, obviously. It's super small. So it's also can be used as emergency contraception. So like Plan B, it's something that you can use if you've had unprotected sex, except this is super effective. It's more than 99% effective. And then as long as you insert it 120 hours or less after unprotected sex. So some of the side effects of the IUD, mild to moderate, it depends on the person. So headaches, cramping, backaches after insertion typically, irregular periods, bleeding between periods, but most of these go away a few months after you've had the IUD inserted. And then the IUD also does not protect against STIs. And then this is another picture of the IUD, and this is true to size. So as you can see, it's super small. So the birth control implant, it's a tiny rod about the size of a matchstick, and it's inserted into the arm by a physician, and it releases hormones to prevent pregnancy, and it can last up to 4 years. It's super small, but you can definitely see it when it's in your arm. So some of the side effects, irregular bleeding is super common, especially in the first 6 to 12 months. Typically, it balances out after that. And then other side effects, which are fairly common, include headaches, breast pain, weight gain, nausea, ovarian cysts. The side effects of this can be pretty bad. And then the implant also does not protect against STIs. And then this is kind of the size of it. It just gets inserted into your arm. So the vaginal ring, or the Nuva ring, it's just a small flexible ring inserted into the vagina once a month to prevent pregnancy. So you have to do it every month. It's left in place for 3 weeks, and then it's taken out for a week. So it works by releasing estrogen and progestin to keep the eggs from leaving the ovaries. And then this is a picture of it. You can see it's flexible. And then the side effects, like most other forms of the birth control we've talked about, include bleeding between periods, breast tenderness, nausea, and increased vaginal discharge. And then the vaginal ring does not protect against STIs. This is a picture. You can just see kind of where it's inserted. So, the birth control patch is another form of birth control. It's a thin beige plastic patch. You stick it to the skin to prevent pregnancy. It's placed on the skin once a week for 3 weeks in a row, and then you take it off for 1 week each month. So the hormones estrogen and progestin, like most of the other forms of birth control, work to prevent the eggs from leaving the ovaries. And then this picture shows, it's a little blurry, but you can see where you can put the patch. So your stomach, your butt, your back, your arm. And then it's fairly effective, so less than 1 out of 100 women get pregnant, assuming they use the patch as directed. And then the side effects include bleeding between periods, so spotting, breast tenderness, and nausea. And then once again, the birth control patch does not protect against STIs. So diaphragms are shallow silicone cups that are inserted into the vagina. When they're in place, they cover the cervix, which blocks semen from fertilizing the egg, so it prevents pregnancy. They can last up to 2 years. And then the diaphragms are effective to prevent pregnancy, but they can easily be pushed out of place during sex. So it's important to use some other form of birth control if preventing pregnancy is the goal. And then it can be difficult for women to insert. You do insert it on your own. And then it's common for women to experience frequent urinary tract infections. Also, diaphragms do not protect against STIs, although they can protect against some cervical infections. So male condoms, which is what most people know and use, they're made out of latex or plastic, and then they're worn by the male on the penis during vaginal, anal, or oral sex. They're about 82% effective. They're not always used right. And then it's important that you get a new one every time you have sex. It protects against both pregnancy and STIs. And then female condoms, which most people don't know about or use, it's a pouch that's inserted into the vagina to prevent pregnancy. It's about 79% effective. And then a new one, like the male condom, must be used every time one has sex. It can reduce the risk of STIs, and it can be used for vaginal or anal intercourse. So we're going to do an activity, and so each student was given note cards at the beginning of class, and the note cards had A, B, C, D, and then true or false on them. So I'm going to ask you guys questions related to the birth control methods that we just discussed, and you're going to hold up your cards, and I'm going to let you know if you're right or wrong. So we're going to do that. Okay, so we did that. And so yeah, does anyone have any questions or concerns? Hopefully you learned a lot about forms of contraception.